I didn't think it was possible. I really didn't. I didn't think it was possible that the case stories that I cover, the patient stories, the comments that I get on the Defeating Pain podcast could get any outrageous. You're going to want to listen to this one today because this one takes the healthcare cake and leads me to ask the question that I've been asking: what is happening to our healthcare system? So let's set the stage. Patient. And this patient has been with me for a long time. He's in his late 30s. He just has a bad low back. Okay, structurally wise, it's not good. And we've known that. So there was x-rays years ago, there was an MRI a while ago, and then a most recent MRI. All we've been doing is basically maintaining, keeping him away from surgery as long as possible and keeping him functioning. He's got 3 kids. He's active. He's a coach. He works out. Normal activities of daily living, right? So he has these periodic flare-ups in his low back where it just hits him, suddenly he just drops to his knees, the pain's bad. And I've gone over and over with him that what happened is back in his 20s, he experienced his first episode, and that's when he probably had a little crack or fissure in his disc. And that started this whole ball rolling here. And so the disc is the most anatomically painful structure in the low back. And so I said, listen, what we've got to do is keep the pressure off the disc, and we need to build up this multifidus muscle in there. And so we started doing that. And whenever he had these acute flare-ups, the first thing I would have him get on would be the BioWave Go. And that would get him out of pain. And then we would do our normal chiropractic flexion distraction technique and our direct current neurological stimulation. And we'd get him settled in, get him taken care of, get everything fine. And then we'd put him on a maintenance schedule one time a month. And this is the way it's been for a number of years. And probably once a year, he would have a major flare up and we'd start the process all over again. About, a little over a year ago, maybe a little bit longer, he texted me and said, it's happening again. I can't get out of bed. This one's a bad one. And hey, I made a house call and took him a little BioWave Go. I said, we got to get you on this. And you know the drill. This time, I need you to use the BioWave Go for 30 minutes, wait an hour, 30 minutes, wait an hour. And I don't want you just totally bedridden, get up and walk around a little bit. But we got to get this under control. It'd be no good for you coming into my office right now. You're really acute and we need to get it under control. So we did. And then he was able to come back into the office and we do what we do in the office. This time it was lingering. He wasn't coming out of it as fast as I thought he should have. And so we referred him on to get an MRI. Now, this is where it starts to get just ridiculous. I need you to get epidural injections because this disc is just inflamed, and the epidural steroid injections is going to be the most appropriate thing to calm your symptoms down. Then we'll get you back in and I can do what I do. We did. He felt fine. He was doing great until about 4 weeks ago, another episode, and bam, it's back. He comes in, he can hardly straighten up. It's what we call an antalgic sign. And these episodes are getting worse and worse every time. I said, we need to get a second opinion on this. And he said, we think alike. I've already scheduled an orthopedic evaluation. And I said, okay, go see what the orthopod says and let's go from there. So the orthopedic specialist recommends a disc replacement. Now, we've already had another kid in our area who, by the way, is 18 years old, and she had to have a disc replacement. And that's another story. Probably do that one in another episode. At any rate, the orthopedic surgeon's going over all this, and this is where it gets mind-boggling, and it's just, you got to be kidding me. He tells him in order for the insurance company to pay for the disc replacement, he has got to go to physical therapy for 6 months. And the patient is, as he relayed to me, he said, I absorbed it in, and he goes, the more I thought about it, the more I got upset. And the doctor went to leave the room and he goes, "Can I talk to you?" And the doctor goes, "Yeah, sure." And he goes, "This is BS." And the doctor then closed the door and realized, "You're really upset about this." Duh. Okay. This guy's been in pain for 20 years. We've been putting the fires out, just keeping him away from surgery. He's been functioning. He's been doing okay. But then these episodes and they're getting worse. It's at a point now where the structure in his back has even it's overridden what I can do. I can't help him anymore right now because the structure is so bad. He's got a wafer thin disc. It's got to be replaced. And so the orthopedic specialist is telling him, well, before the insurance company approves it, you got to go to PT for 6 months. And he goes, "I can't do 6 months. I can't wait 6 months. I can't put my life on hold and not take care of my kids, my wife, even my dog. I can't do that." How many of you sympathize with that? You can tell it's not even my back, and I'm pissed off. He's telling me this, and I'm getting upset. I said, "This is ridiculous. You don't even need to go to PT for 6 weeks because they're not going to help you." And that's nothing against PT, but they're just not going to help you. There's nothing that's going to help this guy until he gets the disc replacement. And then he starts telling me what they would do at PT that he feels would just be an utter waste of his time. He goes, "Yeah, they're going to put me on a stationary bike. Then they're going to have me try to do some core exercise." He goes, "I can't do squat." He can't even squat, as a matter of fact. And so 6 months? Let me know if this is happening to you. Okay, so what I did tell him, I said, "I'm going to talk to the orthopedic surgeon. You've been under conservative care for more than 6 months with me, and that does count. And he needs to let the insurance company know. He needs to write a letter and say, listen, this is what's happening. This guy absolutely is a candidate. He has exhausted all conservative measures. He's done chiropractic care with me. He's done the epidural injections, and he's exhausted all of it. And it's time to get the disc replacement." Let me know if you've had any experiences like this, please. So I did tell him, once you get the surgery, what you need to do is come see me. I'll do the post-surgical rehab on you because we're going to do the active neurological rehabilitation. We're going to need to recalibrate your brain, your muscles, and your joints for this new person into the anatomical neighborhood called your new disc. And the reason I know we're going to need to do this, because that 18-year-old female I was telling you about previously, she just contacted me. And she did have a disc replacement, and she has been doing really well, but all of a sudden she's starting to have low back pain. And she went to the same orthopedic surgeon, and he says, "We may need to do facet injections because your facets are irritated and they're just not working right." No, they're not working right. Facet joints are joints in your spine. It's where the vertebrae line up. No, they're not working right. I can tell you that the muscles in there are not working right. You know why? Because nobody recalibrated them. And the only way to do that is by very gentle manipulations to get those joints moving, very gentle stretches individually at those different segments to get the muscles firing, and then doing a direct current neurological stimulation into the areas that those muscles can't absorb loads and get them firing. They all got to get firing up to the brain. And what's happening right now, like I've been talking about in a lot of these podcasts, the brain has not recalibrated. So what they're doing is they're trying to address this as an orthopedic problem again when it's a neurological. And if you've been watching any of these episodes, you know that is just the wrong way to go. Let me know if you're outraged like I am. And then one other thing, I am thinking about doing a live event on YouTube. Now, I've never done that before, and I only want to do it if you want me to do it. And what the format would be like is be live, and it'd be like the radio talk show from the past where you call in and I would say, "Hi, Sheila," and Sheila would say, "Hi, Dr. Arkfeld, first time caller, long time listener, and I just want to know." You type in your story and we talk about it right then and there. Let me know if that's something you want me to do and we'll get it scheduled. Until then, hey, let's keep defeating pain together. And don't forget to subscribe, keep the comments going, and remember, I'm your advocate. I'm there for you. Okay? See you next episode.